Welcome, friends. It's Bob and Fran, your healthy aging advocates, authors, and proponents of a whole food, plant-based lifestyle.
Today, our special guest is Dr. Caldwell Esselstyn, the esteemed surgeon, researcher, and clinician at the Cleveland Clinic. He is a respected pioneer in the whole food, plant-based movement. He was featured in the Forks Over Knives documentary and is the author of the life-changing book, Prevent and Reverse Heart Disease.
It is our honor and our pleasure for you to be visiting with us today, and we welcome you.
We want to tell you that we feel like we know you already, and I'll tell you why. We were very fortunate about 3 years ago to have a whole food plant-based doctor move to our community. And the first time we went to see him, he gave us a homework assignment.
That was the homework assignment.
To read Prevent and Reverse Heart Disease.
And we didn't have really heart issues.
No, neither of us had heart issues. And we never had a weight problem, so we didn't give much thought to oil. We thought, olive oil, Mediterranean diet, pretty healthy, right? Well, after reading your book, we eliminated the olive oil. And although our health continued to be good, our weight dropped 10 pounds without even dieting because we didn't realize just how much the olive oil was affecting us calorie-wise.
We sort of view you as a true revolutionary in medicine. I wondered, for starters, if you could share some insights on how you evolved to become an advocate for a plant-centered approach to preventing and reversing heart disease. Could you speak to that?
Sure. It really probably had its genesis in 1979 or 80 when I was chairman of the breast cancer task force. I became increasingly disillusioned with the fact that for no matter how many women I was doing breast surgery, I was doing absolutely nothing for the next unsuspecting victim. That led to a bit of global research on my part, and it was quite striking to identify that there were numerous cultures where breast cancer rates were 30 and 40 times less frequent than in the United States. And if you looked at rural Japan in the 1950s, breast cancer was very infrequently identified, yet as soon as they would move to the United States, by the second and third generation, they now had the same rate of breast cancer as their Caucasian counterpart. And perhaps even more compelling was, in 1958, in the entire nation of Japan, how many autopsy-proven deaths were there from cancer of the prostate? 18.
18.
Pretty mind-boggling. By 1978, they were up to 137, which still pales in comparison to the 28,000 men who will die this year from prostate cancer in this country. So somewhere along the line at this time, it became apparent to me that there would be more bang for the buck if I could look at heart disease, because as part of this global review, it was increasingly apparent there were multiple cultures where cardiovascular disease is virtually non-existent. I mean, if you think about Okinawa, rural China, Central Africa, the Papua Highlands in New Guinea, the 𝗪𝗓𝗓, northern Mexico, heart disease is not there. What an embarrassment for the medical profession to think that we've known that for over 100 years. And yet, do we ever take that information from those cultures and bring it to our country to eliminate heart disease? No. We deal with drugs and stents and bypasses, none of which have a single solitary thing whatsoever to do with the causation of the illness. Yeah. So when I recognized that it had to be cardiovascular disease that would be the point of entry into perhaps getting rid of these diseases, you can't just do this by making a pronouncement that people should stop eating to hurt their heart. You've got to do the research. And that's when I was still by 1985 when I started our first program. It was small because I had my surgical obligations that I had for as a general surgeon, and that's how it got started.
Our viewers are very interested in healthy aging and healthy eating. So can even older people benefit from switching from a typical SAD diet, the standard American diet?
My oldest patient, he started with me at age 87. He came from California to Ohio. He'd been told that he had to have bypass surgery. He didn't want to have it. And of course, like everybody who is going to have elective surgery, if they are willing to make a commitment to whole food, plant-based nutrition, they won't have to have their intervention, which is worthless in terms of having anything to do with the causation of the illness. And there are significant downsides, obviously, from that. So the oldest patient was 87 when he started,
100
and he will be 100 this May.
Oh, great. So I'm wondering, how fast can a person reverse a chronic issue like high blood pressure, high cholesterol, diabetes, or even heart disease?
By switching.
Obviously, it varies with the individual and the degree of commitment that they make.
Yeah.
Full plant-based nutrition. So it's hard to say any one figure, but we can see reversal from a standpoint of a PET scan. In other words, if you do a PET scan on somebody who comes to you when they first see you and they've got an area of ischemia in the heart muscle that is very clearly being poorly perfused with blood. We've seen as early as 3 weeks, when you repeat the PET scan, after they've started the program for 3 weeks, you can see the area that has previously been poorly perfused, now it's reperfused. In other words, the vessels have opened up. What happens in those situations, and one of the reasons it happens so promptly, is that when we first see these patients, their endothelial cells are really pretty beaten up. I mean, I'm talking now about the cells that, as you know, line the innermost layer of the artery. And the endothelial cells manufacture a truly remarkable molecule of gas called nitric oxide. And you recall that it is nitric oxide, which one of its jobs is it's the strongest blood vessel dilator. And so when these people come to us and they are so diminished in nitric oxide, they don't have very much of a vasodilator. But as soon as you start getting them to change their eating habits and you have restoration of the endothelial cells to make nitric oxide. And the other thing that happens is that when we first see patients, when they come to us, their endothelial cells have really become their enemy. And by that, I mean, they are making two molecules that are vasoconstrictive, endothelin and thromboxane. And so that's another reason that in 3 weeks, you can see this begin to open up, because when you think about it, I have a wonderful slide that shows all of the heart without any muscle on it. So what you see is this configuration of the heart, all made up by all these vessels. And where the three main vessels of the heart go, they dive into the heart muscle. And in this slide, you can see literally the thousands and thousands of interconnecting vessels. And it's really quite striking that when you ask a senior clinical cardiovascular pathologist, how often in the deceased, when they go through 200 hearts, dissecting them on the deceased, how often do they ever see any kind of plaque or blockage in the coronary artery once the artery has dived into the muscle? His answer, never. So what is happening is all these thousands of interconnecting intramuscular arteries are all pinched when we first see these people because of endothelin and thromboxane, the molecules that made by endothelial cells when you're so mean to them, when they become your enemy. So suddenly within 3 weeks, this entire intramuscular cascade of interconnecting vessels opens. It's not the opening because they don't have blockages within them. It's just that they're crimped, they're pinched because of, and so suddenly what you do is you open up these thousands and thousands of interconnecting vessels. And that's why a patient literally within 4 to 6 or 8 or 10 days after you start treating them, let's say previously they had to walk 2 blocks before they got chest pressure. Now they have to walk 6 or 8 blocks before they get chest. And you've got them hooked. They suddenly realize that what they're doing is making a profound difference.
Great. Now, I know that that's wonderful regarding the heart, but a lot of people are concerned about cognitive health. How does a whole food plant-based diet benefit one's cognitive health?
Better blood supply to your brain. I mean, it kind of stands to reason.
Yeah.
Yeah.
That's good. I know there's so many people concerned about dementia these days.
Well, it's interesting. When you look at dementia, there's a wonderful study by, can't remember her name right now, from the West Coast, who in 2001, they had looked at over 5,500 MRIs of the brains of Americans. And at age 50, they begin to see these tiny little white spots, which are little strokes. But, you know, at age 50, it's a big brain and it's tiny strokes. So really not much of a problem. However, suddenly you're no longer 50. You keep eating the American way and now you're into 65 and you find yourself more often than before saying something like, "Sweetheart, where'd I leave the car keys?" Well, you kind of get through that. Bingo, you blink your eye and you're 75. You look at your wife and you say, "Oh, sweetheart, where'd I leave the car?" Well, you kind of get through that. Before you know it, you're 85. You look at her and say, "Are you my sweetheart?" I can't change that. That doesn't get reversed. You don't suddenly develop that dementia at age 85. You work hard in all those preceding decades to lay the foundation for vascular dementia. Yeah.
So we're very big proponents of using the whole food plant-based diet as a way to prevent disease and disability. Earlier, about 16 years ago, I had a kidney cancer, renal cell carcinoma. And they used a cryoablation surgery to dissipate the tumor. They were able to take that off, and the doctor said, "I'm good to go." But he warned me that this type of cancer could return. So I went plant-based to prevent this cancer from returning. And I wonder what your thoughts on the idea of eating plants to prevent disease or disability. I assume that is part of your thinking process.
You know, I don't know that I can honestly say that I've done a study on patients with cancer or prevent, but obviously it appears that it's interesting when you look at cancers and you think of the the primary phase for a cancer it has to have two primary phases. Initiation. In other words, something has to happen that produces the cancer cell in the first place. In other words, whether it's epigenetics, some twist of during the replication process of our cells, because all day long, every day, we are absolutely reproducing cells, right? And it's really quite striking that there are not more of these errors, but when an error occurs and then you start replicating the error, that would be, let's say that we call that the initiation. The other thing though that happens probably with, this is what my friend Colin Campbell feels, and I'm inclined to agree, that what happens is this, with the American Western diet, that's what we call the promotion of the cancer. So you have to initiate it, get it started, and then you promote it. And where apparently nutrition perhaps plays a role is in promotion, because he did some wonderful studies with rodents with the alpha toxin, and he created clusters of cancer in the liver of these rodents, and he was able to take a protein, and if you kept it at 5% in the diet, the tumor would not grow. But as soon as he raised it up to 10, 20% with this protein, it absolutely would explode. And then if he took it away back down to 5, he could actually have it shrink. And then if he reintroduced it at this upper level, so literally what Colin Campbell was able to do in this rodent model was to turn cancer on and off. What do you suppose was the protein that he was using to turn it on and off? Casein, the lead protein in dairy. Yeah. Right.
Yeah. I want to share with you something that happened recently with us here. Before COVID, we used to put on programs at the local co-op, where we would show the movie What the Health, then we'd break for a plant-based lunch, and then we'd come back and I'd show people how they can transition to a whole food plant-based diet. Well, with COVID, we stopped doing that. But one day we were walking we live in a little neighborhood, and we were walking, and one of our neighbors drove by and stopped, and he said, somebody told me about the program you used to put on. He said, he's like in his 50s. He said, I've got a lot of heart disease in my family, and I'm very concerned. And so this woman who told him about our program said, she told me to talk to you. So he said, I want to do something to prevent this from happening to me. So I gave him a homework assignment. I said, you go to Amazon and get this book. He immediately got the book, read it, switched his diet to plant-based. Within 2 months, I think it was, he lost 28 pounds. He went to the doctor. All of his vitals were excellent. And then, this was great, a couple of months later, he passes us and he says, got to tell you, my doctor said I've got to eat fish. And he started eating salmon. And this is not an isolated story. We've had so many people tell us their doctors say they can't get all their nutrients from plants. They have to eat animal products.
So what can people do about that when the doctor gives them the opposite message that we're talking about?
Well, you just have to. One of the realities that actually we're constantly up against, and that's the fact that why would you want to get a life of mercury, dioxin, and so forth? I mean, it's kind of crazy when you think about it. And also, it's interesting that one of the earlier studies that 𝗂𝐎𝐍𝐂𝐎𝐍𝐻 did, I think, of when he looked at the the Inuit Eskimos off of, I think it was Iceland, they were loaded with heart disease and they thrive on salmon. And it's just what you're dealing with is the fact that sadly in medical school or in postgraduate training, the priority of any education in nutrition is practically negligible. And so it's not that these people are mean-spirited. They just don't know any better.
Yeah. Here's a question that we just got in the mail yesterday. So I could use your help with this one.
And we get this a lot.
She says, my husband insists on eating meat and I don't. How can I convince him that it's unhealthy and to go plant-based with me? So we get that type of question regarding a spouse or a family member, and wondered how you would answer that.
Well, I think that really what it requires is pretty much education. And don't let me forget that question, but because I'm going to drift for a minute into the reason that right now we're running around a 90% adherence or compliance. That is to say, I still conduct a monthly seminar for patients with cardiovascular issues. We limit it to usually, it has to be virtual now. We limit it usually to 18 or 20 patients. And they're almost pre-selected because they're not physician referred. Almost 99% of the patients that we're seeing are self-referred. Either they've seen the movie Forks Over Knives, or they've read the book, or they've gone to my website, or they've gone to YouTube and heard some presentations and they want to know more about this. And so they all have a cardiologist at home. Most of the patients are throughout Canada, throughout the United States. And last month we had 3 from overseas, Singapore, Greece, and Switzerland. And now, if you're going to have somebody make a lifestyle change, that's really quite challenging to have somebody change the way they're eating. So the only way you're going to be successful, as far as I'm concerned, is you must show the patient respect. And the only way you're going to show them respect is to give them your time. So this is never going to work with a 10-minute office visit. Never going to work. Our program consists of 2 main things. One, the seminar itself is 5.5 hours. And I don't know if you know any physicians who will spend 5.5 hours with their patient. And
5.5 minutes.
And then the other part of it that is, I think, key is I'm a little bit old-fashioned. And my secretary will give me the names and phone numbers of who is going to be attending our seminar. And I will personally call each one of them myself so that I can get my arms around their story. And at the same time, provide them with an opportunity to ask questions of me, so that coming to the seminar, we have a strong platform from which we can all move forward. And the absolute key is that they must understand the science. And it's my responsibility with those 2 exposures to me to have them grasp the science. That is to say, they injure their endothelium through the Western diet. The endothelium cannot make nitric oxide. They become nitric oxide deficient. They make heart disease. When they understand that it's not their genes, it's not their inheritance, that they themselves have made this disease, and we are empowering them to be the locus of control to reverse their disease, restore the capacity of their endothelial cells to make nitric oxide. So as part of this education, what they're going to, and this is for the patient who's eating meat, they're going to learn several autopsy studies. And one of those is a study of autopsies of young women and men between the ages of 17 and 34 who have died of accidents, homicides, and suicides. Now, early coronary artery disease is ubiquitous. So if that individual that you're talking about who's eating meat is over 17, you have to look them in the eye and say, well, we already know you've got heart disease. You've got cardiovascular disease. We don't know how much of it is in your carotid or how much is in your heart, but what happens is between 17 and 34, by the time these people have reached age late 40s and 50s, we begin to see this tsunami of cardiovascular disease, because it didn't just develop in their late 40s and 50s. It's simply, that's something they've been nursing along since literally since teenage years. And now it simply is, so that person who's eating meat is eventually going to crumble, whether it's going to be from vascular dementia, whether it's going to be from a stroke, whether it's going to be from heart attacks, or it might be peripheral disease. But they're not immune, and they just have to. You have to have a situation where they can be exposed to enough of the science and the data that they can make a rational decision. Or if they are resistant, then simply somebody like that should get a calcium score or a CT scan. And then when they see their early blockages or the fact that they've got plaque that are loaded with calcium that are not large enough to cause them symptoms, then why would somebody knowing that they have early heart disease want to behave in a manner that they can make it grow?
Good idea.
Yeah, I think you just answered the next question we get. People have a real hard time giving up oil for cooking and for salad dressing, and
I wrote a paper, that they can easily read. I wrote a paper that was published in the International Journal of Disease Reversal and Prevention in 2019. The title of it was, "Is Oil Healthy?" And I reviewed the animal studies and the human studies showing the devastation to the endothelial cell.
Because there was really, a few years ago, the Mediterranean diet was all the rage. And I remember we used to even have like little dishes of olive oil on the table when we served dinner, and put a little pepper in it, and you would dip your bread in it. And that seemed so healthy at the time, but we know better now.
I think it was my good friend, Neil Barnard, who did a comparison study of the I think it was the Mediterranean diet versus plant-based. And of course, plant-based diet just blew away. The Mediterranean diet is great if you want to slow the rate of heart disease progression, but I don't think that's the goal that we want.
Right. Another question we get do you advise people to take any supplements on a whole food plant-based diet? And if so, which ones?
I like to take B12. Yeah. But I think there have been a couple of articles in both in the one in the New England Journal of Medicine, the other in the, I believe it was the American College of Cardiology, where a group of really highly respected physicians have pretty well indicated that you're much better off getting your nutrients from your food. But maybe I personally don't feel that it's important to take B12.
Yeah.
So,
and maybe I'm going to be inclined to feel that way about vitamin D as well, because as long as you don't overdo it.
Yeah.
here's another one. This is a good one. Got this, yesterday, I think. I can't go whole food plant-based because I can't give up cheese, and I can't give up.
Well, no, some people feel that way about cocaine, you know.
So the question is, can I cheat a little bit on a whole food plant-based diet?
Well, I think I can answer that best by a couple that I was counseling maybe a couple of weeks ago, who the husband had a heart attack, and I went through the whole 9 yards about the endothelial. The reason that he had his heart attack was because he had progressively destroyed his endothelial output of nitric oxide. And then she looked at me and said, but Dr. Esselstyn, that's fine, but what are the cheat days? And I said, well, I'm not sure I'm clear. Would you spell that for me? Yeah, she said, CHEAT. I said, you mean like if he's good all week long, he can cheat on Saturday and Sunday? Yeah. I said, no, let me just put it in context. What you're saying is your husband has his heart attack because he's destroyed enough of his endothelium that he didn't have enough nitric oxide to protect himself from making the blockages and plaque. And you're asking me if it would be okay for him to continue 104 days out of 365 to continue to destroy his endothelial production of nitric oxide and the few endothelial cells he has remaining so that he can have a second heart attack. Is that what I'm hearing? Oh, I didn't think of it that way.
Another question we've been getting a lot of recently are concerning whether or not people should be eating these plant-based, like fake meats. You see them advertised now in restaurants.
Beyond Meat and Impossible
All those
Burger.
So many new ones.
They're filled with oil. They got heme iron. They're just they're very unhealthy, and I certainly encourage our patients to avoid that. There may be a day that they come where they can make one that isn't harmful, but there's never been any studies on these about whether they're safe or not. And I've had some patients one patient in particular who converted to that and had a heart attack.
Now, there's a lot of confusion out there. There's a lot of popular online doctors. Some say you shouldn't eat potatoes. Some say you shouldn't eat grains. Some say you should eat a nutritarian diet or a flexitarian diet. People are so confused, they don't know what to believe.
Read my book.
Good answer.
Read my lips.
Oh, there's anytime you've got something which is so intensely personal, there's bound to be skeptics, which is fine. But I think what we have to be guided by is the science, and I think that one way to do that is, I think it was Richard Feynman, a physicist, when he was getting his Nobel Prize, he said that the proof is in the scientific method. And the scientific method consists of two things. One, you make a hypothesis, you theorize. Number two, you do the research, and the research is either right or it's wrong. So let's say you make a hypothesis that if you eat plant-based, you might be able to stop heart disease or reverse it. You do the experiment. It happens not once, not twice, not thrice, but hundreds of times. Case over. There's no other diet that can reverse, that I'm not aware of, that has ever reversed heart disease other than a plant-based diet. Not the Mediterranean, not the Western diet, no.
Another question we get is, and we get this too often, we feel a little uncomfortable even talking about it, but a writer recently asked, I had some heart issues, but after surgery, my doctor did not tell me to change my diet. And even in my own case, doctor, when I had this cancer and after I saw the physician and told me to beware it could come back, he didn't tell me to change my diet. And I'm afraid to say that most doctors today just say, well, you're cured, go out there, live your life.
Do what you are doing.
Yeah. And what can we do about that? So what's the average person to do? I mean, we tell them.
The doctors never get any education in nutrition, so they can't you're asking them to do something for which they've never had any training. As a matter of fact, 6 years ago, I was invited by the American College of Cardiology to become a member. They wanted me to join their nutrition committee, which I've done. And one of the jobs of the nutrition committee is to try to educate cardiologists about the disease they've been designated to treat. And let me tell you, it really is like trying to turn around the Queen Mary. Because, and I've always been a little bit hesitant to say this for the first 15 years or 20 years, but I really, I think it has to be spelled out now. And that is, there's a huge difference in compensation. When you think what the compensation to physicians is for putting in a stent or doing bypass surgery, as compared to talking to somebody about Brussels sprouts and broccoli, there's a difference. And it may be subtle. And I'm sure many of these physicians really obviously want to have their patients get well. But one of the things that most characterizes my practice today are patients who call, and let me be clear about this, that if somebody's in the middle of having a heart attack, something like a stent or bypass could be absolutely life-saving. But many of these procedures are offered electively. And we have found that with the patients that will convert 100% to whole food plant-based nutrition, there's no reason they have to have these procedures. And there's now a nice, really large randomized study called ischemia. And ischemia was presented at the American Heart Association meeting in November of 2019 in Philadelphia. And there were 5,000 patients in ischemia, divided into 3 groups. And one was optimal medical therapy plus bypass, optimal medical therapy plus stents, and then optimal medical therapy alone. At the end of 5 years, when they looked at major cardiac events, heart attack, stroke, and death, between the 3 groups, no difference. My criticism of the study is to compare to actually our medical approach. Do you suppose those 5,000 patients for 5 years didn't have a drop of oil? Do you suppose those 5,000 patients for 5 years were eating green leafy vegetables 6 times a day? And, you know, so that, I mean, I'm sure that the optimal medical therapy would have blown it away. Of course, it would have helped the others as well. But it's sort of interesting that the science would indicate that if patients are willing to do this, they're not going to have these procedures. And right now, the cost of cardiology is 46% of Medicare. And what is cardiology? It is the non-treatment of the causation of the leading killer in Western civilization.
I wonder if you could just give us some idea of what's going on trend-wise in the plant-based movement. Are more people, as far as you understand, going toward that more healthy eating?
Oh, totally. I mean, when you think that when you imagine what it was like when I started this in 1985, I mean, it was Dean Ornish and myself.
I can't imagine it.
And I mean, and everybody just totally, and even today, obviously, there's resistance, but it's so enormous. Here you have the Plantrition Physician Group, 2,000 physicians. You have American College of Lifestyle Medicine, what, 5,000 physicians. Where were they 30 years ago? So still, it's not enough, but it's remarkable.
What, in your opinion, is the best way to start a whole food plant-based diet? You jump in 100%, you gradually change what's in your pantry to more healthy foods. You give it a try for 30 days. What is your advice to most of your patients?
The Menil Chemical Census Center in Philadelphia did an interesting study where they took 3 groups of patients, and one was getting 34% fat, which is the typical measure of the American diet. The other was down at 20%, and the other group was down at about 11 or 12% where we are. And at the end of 12 weeks, one of those groups had lost their craving for fat. Which one? The one at 11%. Because what's happening when you try to make these changes, you have to downregulate your fat receptor and your sugar receptor in your brain. So that if you happen to be very careful all through the week, but on the weekend, you decide you're going to reward yourself because you were so good, then you never downregulate the fat receptor, and you're constantly in this state of misery and denial, and you have recidivism and failure. So we really, and I think it's important to have patients understand what's going on during this time period. And the other thing that when you do it that way, what happens, especially with the patients who are the persons who have some degree of chest pressure, chest angina, or shortness of breath, when they suddenly see that going away, yeah, you got them hooked.
Dr. Esselstyn, we really thank you for visiting with us today and sharing your knowledge and wisdom.
Well, I'm not, thank you. But when you think about the tremendous amount of money that is being spent through Medicaid and Medicare, if you have a healthier population, imagine that the amount of money that would be really put aside for so many other things that we really need.
Mm-hmm.
All right, well, what a pleasure to be with you.
And to our viewers, we love having you on this healthy aging journey with us. We would appreciate you giving this video a thumbs up, leaving a comment, subscribing, and getting notified of our next video. And we look forward to seeing you again very soon. Bye for now.
All right, guys.